Now, there's been a whole lot of talk about the ACA credits, the Affordable Care Act credits, or better known as Obamacare. Now, in this video, we're going to break down the revolutionary idea that President Trump just gave to the Republicans to do. And if they follow through with this, it could be the end to the whole Obamacare as we know it, and a revolutionization of the entire medical insurance game for all of us, making it more affordable and giving us more control. So in this video, I'm going to show you clips from Obama. I have to, because there's some things that was laid out that are direct discrepancies with where we are now. You're going to also hear from President Trump, but even most importantly, you're going to have one of the best understandings of what ACA is, how we got in this mess, and the best way for us to get out of it. So if you're somebody, I mean, if you're over the age of 16 or let's say 18, obviously medical insurance is extremely important. So I don't care if the person doesn't have to be old. You can be really, really young. You could be more mature in life, or you could be right in the middle of the pack. But failing to have medical insurance can be catastrophic to us, because who knows, at any moment, car accident, some fall, whatever. So let's go through it in this video. Now, President Trump's idea for U.S. citizens to get direct payments for health insurance. Trump reveals proposal amid the government shutdown. Now, this article was just released yesterday, and the government was shutting down. I'm going to go through a little bit of it, as you see, on November the 10th, 2025. So this just rolled out, but it's making its rounds, and people are liking what they're hearing. So check this out. U.S. President Donald Trump on Saturday recommended that money be sent directly to people so they can buy their own health insurance, while blasting Obamacare, or the Patient Protection and Affordable Care Act. President Trump proposed a compromise on health insurance payments in a Truth Social post made Saturday morning. Trump called on Republicans to send federal payments that will go to insurers under the Affordable Care Act directly to Americans. The post comes one day after Senate Republicans rejected Minority Leader Chuck Schumer's proposal that potentially could have ended the government shutdown. And of course, as of today, we know they ended it anyway without anything moving forward on this. And they are going to expire on December 31st. So it is a real thing. Americans to get direct money for healthcare costs. Trump urged Senate Republicans in a Truth Social post on Saturday to send the money used to offset the cost of ACA healthcare premiums directly to the people so they can purchase their own much better healthcare. The president did not provide any further details, though fiscal hawk GOP Senator Rick Scott enthusiastically announced on X that he's willing to write the bill now. At present, ACA enrollees who qualify for tax credits, also known as premium subsidies, never see the funds. They are sent directly to insurers to offset people's monthly premiums. Taking the Truth Social, Trump stated, "I am recommending to Senate Republicans that the hundreds of billions of dollars currently being sent to money-sucking insurance companies in order to save the bad health care provided by Obamacare be sent directly to the people so that they can purchase their own much better health care and have money left over." So let's talk about it. Now, when Obamacare passed, it passed without one single Republican vote. And remember, Joe Biden was in office, and the Democrats had the White House, the Senate, and the House. And you know what they did? They kicked the ball. They set the expiration date for December 31st, 2025. So when they come out saying Republican shutdown, Republican healthcare crisis, that's their deflection. They did this without any Republican help. They set the expiration date. Now, they could have extended it for however long that they wanted. They could have did whatever they wanted to with it. But they saw that the tide was shifting and that it was more likely that Trump would win. So their game plan was, okay, if we get back in office and we take control of everything, we can do what we want to do with it. No harm, no foul. But if Trump wins, now he's going to be stuck with this issue, and we'll use our problem against him. And ignorant, sleep voters will believe that what we're saying when we say the Republicans did this, when not one Republican wanted it, not one Republican voted on it, the Democrats single-handedly created Obamacare, subsidized it, and then set the date to end it. As a matter of fact, let's take a walk back down memory lane. And listen, this is important. I know people say, oh, Lord, I don't want to hear them, but these next couple clips are critical to what President Trump is going to say. Check this out.
Healthcare is not a privilege for the fortunate few. It is a right. And I knew that if we didn't do something about our unfair and inefficient healthcare system, it would keep driving up our deficits. It would keep burdening our businesses. It would keep hurting our families. And it would keep holding back economic growth. Now, knowing you can offer your family the security of healthcare, that's priceless. Now you can do it for the cost of your cable bill, probably less than your cell phone bill.
Wow. Now that's one. In the comments, tell me, was he telling the truth or was he not? Now, in this next clip, check this out.
It will actually reduce the deficit by $4 trillion over the long term. Reducing the waste and inefficiency in Medicare and Medicaid will pay for most of this plan. It will slow the growth of healthcare costs for our families, our businesses, and our government. There will be a provision in this plan that requires us to come forward with more spending cuts if the savings we promised don't materialize.
These are the types of things that Barry was standing up saying just to help us remember how we got here. Now, in this one, check out the split. One is going to be Barry or Soetoro, aka Barack Obama, talking to Congress, and a Republican senator is going to interject. But check out what the media thinks is important. Check this out.
Also, those who claim that our reform efforts would ensure illegal immigrants. This too is false. The reforms I'm proposing would not apply to those who are here illegally. It's not true.
In tonight's Fox 17 Waste Watch investigation, the IRS has given $750 million tax dollars to illegal immigrants. It is all in a report released this month saying the money has been given in the form of Obamacare subsidies. This money is handed over without any proof of citizenship. Part of it is hard-earned money from those of us right here in the mid-state.
So, y'all, the whole time Obama was doing speeches talking about how, yeah, illegal shouldn't be here and healthcare won't be going to them. The whole time they already started the illegal immigrant migration. And they already started giving them free health insurance back then. If you're enjoying this video, do me a solid, hit that thumbs up, because I will never ask you for a cash app, a donation, or a super chat. You hitting that like button is more than enough. And if you aren't subscribed to the channel, subscribe. And whether you're subscribed already or subscribing now, make sure that you hit the notification bell and select all, so that way YouTube will make sure you get notified when I upload new videos. This is from 2012. Way back then they were already doing it. Now listen to, let's speed it up, kick it up 13 years, and listen to what he has to say today.
Better's good. Yeah. We're not going to get to perfect. If you're telling me that the Affordable Care Act is going to insure 50 million people, do I think that's better than if we were starting from scratch and I could get a single payer plan instituted and get that through Congress and suddenly we had universal health care and we had taken the profit motive out of, do I think that would probably be a smarter way to do it? Absolutely.
Right.
But since I can't do that, I don't have the votes for that. How about this?
Yeah, we can make it better.
We can make it better. This sense that things aren't worth it unless we get everything we want is either a recipe for disappointment in a democracy, but also maybe in life, or it leads to this weird cynicism where you just withdraw entirely. And that's part of what happened to too many of our folks. We decided, all right, if I'm not going to get everything, that justifies doing nothing. Better's good.
Now, did you hear what he just said? Oh, you know, we got to do everything he said that shouldn't be done under these circumstances is exactly what he was encouraging the Democrats to do and what the Democrats just did during this shutdown. And this video take here was just a couple of months ago. Obama is one of the fakest, most misleading people that I've ever heard speak. The fact that he's a good, sophisticated orator was one of the worst things for America, because he silver tongue lied his way into office with very minimal political or corporate business building experience, and lost his congressional race to a former Black Panther, won for senator, won that. 2 years later was up for president. And we see he was funded by the Soros machine, and he's been used as the go-to guy whenever the Democrats end up in trouble. Now let's listen to what President Trump has to say after all of those clips that you just saw about why he wants to do what he wants to do for America. And watch, the Democrats are going to fight it tooth and nail. And you're going to hear in this video from a doctor with 40 years of experience just why. Check this out.
Well, I watched Obama from when this thing came about. As you know, I opposed it very strongly. Unfortunately, we had a couple of negative votes, which should never have happened. But I said it's going to be a disaster, and I was exactly right. The premiums have gone up like rocket ships, and I'm not just talking about recently. I'm talking about for years they've been going up. And he said premiums will go down. Everything will be wonderful. It's horrible health insurance at a very high price. And what I want, and probably what you're alluding to, is the fact that I want, instead of going to the insurance companies, I want the money to go into an account for people where the people buy their own health insurance. It's so good. The insurance will be better. It'll cost less. Everybody's going to be happy. They're going to feel like entrepreneurs. They're actually able to go out and negotiate their own health insurance. And they can use it only for that reason. That's the beauty, only for that purpose. And if we did that, that would be so exciting. Call it Trump care, call it whatever you want to call it, but anything but Obamacare. Obamacare is a disaster, just like he was as a president.
Here's why I totally agree, and I appreciate the fact that what they're trying to do is give things back to the people. Number one, if you have control of the money to make your own decisions, here's what's going to happen. The insurance marketplace is going to be competitive. It's already happening. I've already been reading reports of batches of doctors, batches of healthcare facilities right now that are networking together to create plans that are more affordable for people within their state, within their regions, that they could offer, that would make these other companies like Florida Blue, that's who I'm with, and Aetna's and all of them have to discount their prices. Now, they don't have to increase their prices. The healthcare providers have increased their prices every single year. And there's a reason for that. Now, before we get into the reason for that, I want you to listen to this young lady, and then I'm gonna let you hear from the doctor, but she gives a really good breakdown of what's going on. Check this out.
Democrats keep arguing that millions of Americans are going to lose health insurance because of Republicans, but are they? During COVID, Biden gave out these Obamacare subsidies, which were basically like a fat government check so people could get Obamacare for cheaper. Obamacare is health insurance. And those COVID-era subsidies are expiring at the end of 2025. COVID is over, but Democrats are arguing that we need to extend those subsidies right now or millions of Americans are going to die. And there are so many problems with this. Number one, the majority of people on Obamacare are going to continue to get coverage at about $50 a month, even without the COVID subsidy. And when those subsidies go away, guess who it's really affecting? Affluent, early retirees, people retiring before 65, making 400% above the poverty line. Which doesn't even make sense. 400% above the poverty line? So like Joe and Jane, who are 55 years old and retired, making a combined income of $130,000 a year, they might see Obamacare costs similar to what they were paying before the pandemic. That's the big, and if Congress decides to extend those COVID-era subsidies, that's going to cost taxpayers $450 billion over the next decade. So the GOP, the Republicans, are saying, hey, we'd love to talk about that and fix this problem, but we cannot do it until you open the government back up. They have the upper hand here because already 60% of Americans want COVID-era funding programs to end. And they are not pleased with Democrats for keeping the government closed just because they want to make permanent those COVID-era subsidies. So do not fall for it when you hear that.
Real quick, something extremely important I want to point out to you. As we go into January the 1st, open enrollment for insurance, health insurance, is happening right now. And for a lot of seniors, some that are just getting onto Medicare, many that are on Medicare, they're terrified. They don't know what's going on. You got Obamacare getting ready to expire, seeing with the tax credits. But at the end of the day, you do have a solution. My partnership with Chapter has been extremely helpful to seniors just like yourself, if that's what you're looking for. They have skilled and unbiased agents that in less than a 20-minute phone call that's absolutely free, they can help you understand if the Medicare plan you got is the best one available on the market. Because it would suck to find out you've been paying into something and your prescriptions aren't covered and your doctor is no longer in network. It's just a short phone call. That's all it takes. So you can either visit the website, the askchapter.org/realpolitics, or call the number on the screen. Either which way, make sure you're protected with the best Medicare plan available. Contact Chapter. Wow, that was a great breakdown. Now listen to this doctor who's going to really air it out. And this doctor's name, let me get it for you. Wall Street Apes, American Doctor. They don't give it specific, but he gives it. His page is Real Doc Speaks. Check this out.
Why do our health insurance costs go up every year? Can't we get 1 year where it's steady or God forbid they go down? And the reason for that is it was designed that way. There's something called in the Affordable Care Act called the medical loss ratio. The medical loss ratio means that insurance companies must spend between 80 to 85% of all premium dollars on medical services. That means they're limited to 15 to 20% for administrative overhead and profit. So that means that they play a little game. The higher the top line is, the bigger that number is. So now all we did was say, let's charge more each year. If you look each year, the insurance companies' revenues go up every year. The second thing they did to get around that was they started vertically integrating. What's vertical integration? That's when you start buying companies that are not insurance companies, but in similar businesses. So they started buying pharmacy benefit managers, which are middlemen for the drug companies. They started buying pharmacies. They started buying physician services and physician groups. So why is that important? Well, think about this. I'm the insurance company. I want to make it look on paper like I'm making my medical loss ratio, because if I don't, I'm going to have to pay a rebate. So what I do is I have my physician over here who's owned, and I overpay him, but he's owned. So when I overpay him, all I'm doing is I'm showing I have an expense here, but it goes back to my other pocket. Same thing for drugs. I can take a $50 drug. I can pay $200 for it. Now I've just gotten around the medical loss ratio because somehow the government can't figure out how to trace that dollar beyond the insurance. So that's how they get around it. And this is why our insurance premiums go up every year, and they're going to keep going up until we change the system.
So in other words, the medical industry is increasing its own prices to continue bringing in the money that is bringing in. It's a wild thing. So in order for us to incentivize them to decrease prices, There is no way to incentivize them to decrease prices. The fact that they've been making record-breaking profits, they can stand. They're perfectly fine. But what's happened is, allegedly, a lot of these senators, and I'm not just talking about Democrats, some Republicans too, they get fat kickbacks from these from the pharmaceutical industry, the medical industry, the insurance providers. They say allegedly, even Obama himself makes around $30 million. Have been paid $30 million from the insurance companies since he left office. You think that was an incentive for him to institute the Affordable Care Act? And remember, I've always told people that whatever a Democrat names a bill, it's actually doing the opposite of that. So the fact that it was called the Affordable Care Act, it was never affordable, and there's documented proof of that. I want you to take a second and listen to this person who was on his insurance, and then when Obamacare hit, and this video is a few years old, but really listen as he breaks down what happened to him in real life and what his choices came down to. He had two choices. Check this out.
With the elections coming up, I thought I would share why I am no longer a Democrat. You know, I have had the ability to vote for people even though I didn't like them. I can honestly say I've never voted against somebody. That's just, to me, the wrong way to look at it. But the thing that got me leaving the Democratic Party was more or less one specific issue. See, I was a 2-time bone cancer survivor, still am. That's how I lost my arm. And having health care was extremely important to me. I heard all the talking points of, you know, if you like your doctor, you can keep your doctor. If you like your plan, you can keep your plan. The average family is going to save $1,500 a year. It's not a tax. All of this stuff made sense to me, how this was being pushed. And then the Democrats were also saying, well, you know, Republicans don't want you to have insurance if you have pre-existing condition. Well, I was a walking pre-existing condition, having cancer twice. My insurance was $185 a month with a $1,000 deductible. That was for a family of 5. So I voted for Biden in 2008 based on Obamacare. Now fast forward to 2010, when Obamacare was implemented. Everything that they said was not true. The Supreme Court ruled that it was a tax if you didn't have insurance, that penalty. So that was a lie. Insurance premiums went up instead of down. That was a lie. The insurance policy that I had specifically, that I had going through 2 bouts of cancer, chemotherapy, amputation, all of this stuff, it was great insurance. The insurance company canceled it because under the new Obamacare guidelines, that policy wasn't good enough. So they no longer offered it. They came up with a new offer and said, this is what your new plan will be, or you can go through the marketplace. And when I looked at them, the cheapest insurance I could find to replace that one was $1,200 a month with a $6,000 deductible. Remember, $185 a month with a $1,000 deductible is now $1,200 a month with a $6,000 deductible. No additional income. So I had to make a choice. Do I keep a roof over my children's head, or do I get health insurance and struggle? And I chose to just keep a roof over my children's head.
Now, you know it's bad when you got to decide between living and getting health insurance. The fact that your medical insurance, it can be the same amount, if not more, than your mortgage is insane. So tell me, what do you think? Do you think it's good? Would you support having control of a financial savings account where you could make your own decision and buy your own insurance for more competitive people, rather than having to go through the Unaffordable Care Act portals or that marketplace? You can make your own decision. You can help stimulate small business in the medical industry like it used to be. I remember when I was a kid growing up, we had our doctor, but there was doctor's offices all over the place. I remember that. You had choices, but as years went on and things changed and laws changed, and they've allowed, allegedly, the insurance industry to write the laws. They allowed it. Now, of course, they don't come out and say, hey, the insurance industry wrote it. No, a part of their team, their legal team writes it, gets them a Democratic senator that goes out there and presents it as their bill, but they didn't write a word of it. Their staff didn't write a word of it. It was totally written by the geniuses over in the insurance company that found them a weasel and somebody that's willing to sell out the people for a couple of bucks, and it lands us where we are today. So I just wanted to bring this to you to find out how you felt about getting the health care money that would be paid to Obamacare directly to you. Do you feel like that'll work, or would you like the subsidies to keep going on? So if you've hung out and watched it up to this point, I want to say I thank you so much from the top and bottom of my heart. I really do appreciate you. And like always, if you haven't hit that like button, please do. And if you aren't subscribed, subscribe. And most importantly, I want you to stay safe and you be great. I'm Brian Maxwell saying I look forward to seeing you at the top. Over and out, y'all.